We've been given greater insight into our country's mounting death toll from COVID-19. More than 90% of people who've died from the virus had one or more health issues, including heart disease, dementia and asthma.
When explaining how people died from COVID, this is what we've heard almost every day.
All four had significant underlying health conditions.
Both with underlying health conditions.
Underlying conditions.
But now we know what these conditions are. New figures from the Bureau of Statistics show the conditions that have led to the most Australian coronavirus deaths were chronic cardiac conditions, dementia, diabetes, chronic respiratory issues, hypertension, cancer and kidney disease.
People that died were disproportionately those with underlying conditions. Well, that's an awful lot of people in society. And whichever way you look at it, those people's lives were shortened.
Of the more than 2,600 people who died with COVID in Australia since the start of the pandemic to the end of January this year, almost all of them had one or more other health issues listed on their death certificate alongside COVID-19. Plus, the majority of deaths have been working class migrants.
If you're socially disadvantaged, you are much more likely to get COVID and also to come to grief. And disproportionately, that's recent immigrants.
907 people born in Australia have been killed by the virus, while 1,640 of those who died from COVID here were born overseas. 732 of those were from Southern and Eastern Europe, 288 from North Africa and the Middle East, 220 from the UK and Northwest Europe. Even with a spike in cases today, over 10,000 hospital admissions are falling, giving the government some confidence that it can scrap compulsory masks and mandatory QR codes at the end of the month.
We've taken a cautious approach over summer. We think that's been the right course of action. We'll consider this as soon as we can remove those restrictions when it's safe to do so. That's exactly what we'll do.
Whether the lessons of the summer of Omicron have been learned remains to be seen. Chris O'Keefe, 9 News.